Do the symptoms sound familiar? Difficulty in swallowing, pain in the chest or upper abdomen, and especially heartburn. They can be the start of dangerous changes in the tissues of the esophagus, which can lead to cancer, to Barrett's carcinoma. Each year, some 7,000 people in Germany develop this form of esophageal cancer. It is a type of cancer that has increased rapidly in recent years. Professor Ines Gockel, Director of Surgery at the University Hospital in Leipzig, is heading an international study that aims to discover what causes Barrett's carcinoma to develop. It is known as G4B, meaning Genes for Barrett's. Scientific investigations show that the risk of developing the disease is related to our lifestyle. For example, to factors such as obesity, lack of exercise, smoking, or a poor diet. In the study, the scientists are looking for the genes that are involved in the development of the cancer. At the beginning of the illness, there are frequently no symptoms. However, it is almost always triggered by frequent acid reflux with heartburn. The result is that gradual changes take place in the cells of the lower esophagus, with serious consequences. During reflux disease, the esophagus no longer closes properly where it enters the stomach. The acid gastric juices repeatedly flow into the lower esophagus and cause damage. After a while, the cells, which were flat and smooth in their original healthy state, become cylinder-shaped. The result is Barrett's esophagus, which in its early stage is still benign. But sometimes the cells may change over time or proliferate in an uncontrolled manner. They then degenerate and become malignant. So the preliminary stage can develop into cancer, Barrett's carcinoma. If the tumor grows and constricts the esophagus, the patient will often start to have difficulty in swallowing. At this point, he or she may also suffer from pain in the chest and stomach. During the advanced stage, he or she may lose weight or may already have metastases in the lung, liver, or other organs.
That is why we have to work fast and in a targeted manner. Together with our team, we, that is, the doctors and scientists, must identify the genes involved in the development of the illness. This is the aim of this study and of the interdisciplinary Barrett's Consortium.
The Barrett's Consortium is an international research group, which works from many locations in Germany, Stockholm, Zurich, and Prague. Its headquarters are in Leipzig. In the Leipzig Study Center, and in all the centers cooperating with it, patients can contact the study team and apply to take part. A team of some 30 doctors from all specialty fields and various scientists aim to carry out research into all aspects of the causes and risk genes for the development of Barrett's esophagus and Barrett's carcinoma. It is the biggest Barrett's consortium and one of the largest Barrett's collectives in the world. The consortium has already enlisted 3,000 participants for the study. Anyone affected can take part, whether they suffer from the early stage, from Barrett's esophagus, or from cancer. Everyone is important. It does not require much time for patients willing to take part in the study. They give a blood sample and fill out a questionnaire, and that's it. The more people take part in the study, the higher the value for Barrett's patients all over the world. In this way, the scientists can gain greater insight into the origins and development of the disease. With your data, in future it will be possible to prevent the illness more effectively, recognize early stages earlier, and treat Barrett's esophagus in a more targeted manner. This knowledge might even lead one day to preventing the development of Barrett's carcinoma in the first place. But in order to achieve this, we must recognize the changes early on and implement the right measures.
If we can manage to develop a test for early diagnosis on the basis of the results of our study, then this will most certainly be a huge success.
And so, only more knowledge about the causes of this form of cancer will help us all to heal the disease in the future. So please help us too. Taking part in the study wasn't a problem for me at all, and the effect may be a huge one. I'm taking part in the study because it's easy for me to do so, and it may help generations to come.
Help us to shed light on the causes of Barrett's carcinoma.